Welcome, everybody, to my Doc to Doc series. I'm Dr. John Torres with NBC News, and I have these Doc to Doc series every week so we can get some information, some really good information about what things mean that we hear about the pandemic, about coronavirus, and about your health. And the goal is to make sure that you get information you can walk away with that hopefully helps you, your family, your loved ones, and your community get through this pandemic sooner rather than later and as healthy as possible. There is a lot of confusion out there, so we want to try and get through that confusion with good information. And to do that, I use experts from around the world. And today we have an expert that I'm very excited about because this is a very strong topic over the past few weeks. And just so I can get all her credentials down, Dr. Susan Butler-Wu, she's the Director of Clinical Microbiology at LAC+USC Medical Center. That's Los Angeles County and University of Southern California Medical Center, Associate Professor of Clinical Pathology at the Keck School of Medicine at USC in Los Angeles. And for our purposes, her research focuses on rapid diagnostics for infectious diseases. Rapid diagnostics, that means testing. Right, Susan?
Yeah, that's exactly what I do. So my job is I'm a clinical microbiologist and I oversee testing in the hospital. And that includes both old school slow tests and also quicker tests like that. That's really the hot topic for the last 2 years, I guess.
And I think, now we're, almost 2 years into this pandemic. Most people have tested many, many times throughout this pandemic. And the testing, I think most people understand the antigen, which is also, they call it also lateral flow in other parts of the world, right?
That's correct. Yeah.
Yeah. So antigen, which is lateral flow, or the PCR testing, which are the two main categories for the testing, they both do different things. But right now I want to talk about, what's going on here in the US and kind of the newsy part of it. And the Biden administration said mid-January that we would start having tests available through the government. We're mid-January, not quite there yet. And they keep saying it's going to happen. It's going to happen. Do we need that?
So I think obviously, I think it's a really helpful, important thing to have. I do. And what I'm about to say next does not negate the need to do it. I think that testing, particularly in this country, has been held up as like the rapid test is like the ultimate solution to ending this. And I think what we have to remember is an important part of the solution, but it's not the sole solution. And so countries like the UK, for instance, Germany, where they've had either government provided tests in abundance or very, very cheap tests compared to here, it's not solved their problem there. But certainly we have to look at trying to stop as many chains of transmission. So if I have COVID, breaking that chain so I don't pass it on to somebody else as possible. And testing is certainly one piece of that, not the only piece, but an important piece. So I think it's a good thing.
No, I said, I think you bring up a great point because the CDC, the government, has gotten a lot of criticism over reducing the quarantine time, but not including testing in that quarantine reduction and when you can go ahead and go out and about. Like you mentioned, other countries do have that. The UK, for example, they've reduced it to day 7, but you have to test negative at day 6 and day 7 in order to leave quarantine. But it hasn't been the silver bullet for them. It hasn't completely gotten rid of the pandemic. They're still going through issues. Should we have had testing in that quarantine requirement, that isolation requirement?
So I think let's maybe take a step back and ask what the testing does. And first of all, what do we know about transmission? And so one of the things we know, obviously, when you get infected with COVID, that you're maximally infectious right before you develop symptoms and then for a couple of days after. And I think my understanding is a lot of the CDC recommendation was born out of epidemiological data showing that by 5 days, most transmission has occurred. But one of the things that we have to remember too, is that by even a week after symptoms, 30 to 40% of people will still be shedding infectious virus. So one of the things that has kind of troubled me is obviously they stress the need for continued masking, but I am concerned that, there will be people out and about that maybe won't. We're 2 years in. How often are we still seeing underwear masks? Frequently. And so that is one concern of mine. Now, I think we have to understand what the negative test tells us, particularly if we're talking, there's no point in doing a PCR, obviously, because you'll stay positive for quite some time after you've had the infection. So what is an antigen test? Fundamentally, I think there's been a lot of information out there that it's an infectiousness test. It's a test for a lot of virus. So in order to be positive with an antigen, you have to have over 1 million copies per milliliter. So a lot of virus to be positive. So then the question is, are you not infectious when you have less virus? And that's where we have to, I think a lot of the conversation around infectiousness has really solely focused on the viral load, how much virus you're shedding. And that's what the antigen test is looking for, a lot of virus. But if I'm shedding less virus and now I'm unmasked in a room with no ventilation, I'm still an infectious risk. So I think there has to be a more nuanced conversation. Certainly, do I think that if I were testing positive at 5 days, like strongly positive with an antigen, that I should probably be going out? No. And so that's why when they revised their guidance, they added that little bit about if you have a test and you want to take it and you're positive, then you should isolate for 10 days. But no, as you said, it's not set up the same way as the UK at all.
And this antigen test, which are the tests that most people take, and I have a perfect example right here, the test, that we all get at home, and we take them. It's a snapshot in time. And I've been told 6 to 12 hours is kind of what you can look at going, okay, it gives me some assurance for 6 to 12 hours that I'm okay if I'm going to go over to a friend's house or somebody else's house. But beyond that, it really doesn't give us much information. Is that right?
I'm not even sure I agree with the 6 to 12 hours. And I'll tell you why, John, because there hasn't been enough focus throughout this on the impact of what we call pre-test variables, right? So how good you are at collecting that specimen. And there's a really nice study that was published in the UK. So the UK, in order to have their program, they evaluated loads and loads of different tests. So they lined them all up and they did a really detailed analysis. And they said, right, this is the one that we're going to use to provide to people for free. And in the process of doing that, they actually looked at the sensitivity of the test. So how good it is at detecting whether you really are infected. If you are a person in your home, if you are like a nurse doing the test, or if you're a trained lab professional. And the sensitivity goes, highest is lab professional, then like nurse or other medical professional, and then home. So we have to understand that it's not only a snapshot of time, but if we don't collect a good sample, that can also cause us to have a false negative result. And we know from programs where they've done daily testing, like collegiate athletic programs, that there were instances of people basically having a negative and being symptomatic and highly positive by PCR the same day. So the way I view it is, it's not a guarantee because it is a snapshot in time. We need to view it as risk reduction. It's not risk elimination. And I think that a lot of it has been like, I get my test, I'm good to go. And you have to really, especially now with Omicron, I think that calculus is completely different.
Well, Susan, let me ask you this, because people are always looking for these real world examples, and people using these tests for a variety of different things. And a lot of people are saying, okay, I'm going to a party at a friend's house there'll be a lot of people there that I don't know, that we're mingling with. I'm going to take a test. Everybody else is required to take tests before we go. Is that appropriate?
I think it's, and I understand why this is very frustrating for the public, because the answer to that 2 months ago or during Delta is different than it is now. Because one thing that we know, that although the vaccines are incredibly effective still at preventing against serious disease and hospitalization, they're not as effective as they were against previous variants in terms of preventing infection to begin with. So I think doing that back in the days of Delta is a different proposition than doing it now in the days of Omicron. Personally, like, just speaking for myself, with the way things are looking right now and things are surging, I wouldn't be going to a party right now on the basis of a negative test. I'd be saying we might want to reschedule that party until things kind of come down numbers wise, because there's just we've never lived through a time with this much of infectious diseases raging in our lifetimes, right?
Well, how about going over to your family's house? And everyone's saying, well, we're all going to get together, Thanksgiving being a prime example or something like that, where it's just going to be family members. Everybody's vaccinated, everybody's boosted, and they're saying, let's go ahead and get a test before you go there. Is that a good thing to use a test for?
I think so. I think it's a good thing to do the test, because what does the testing allow us to do? If I test positive and now I don't go to the party or the get together, that's great, right? I've prevented that chain, that transmission chain and onward transmission. I've broken the chain. The complicating thing is when everybody's negative. Again, it's risk reduction. So right now, honestly, a group of people indoors, unmasked, vaccinated, or, if you're boosted, we know this happened in the UK, right? Like there was and in Norway, I think, was it a wedding or something? There's a
wedding, a lot of people.
Yeah. And so that's the situation we find ourselves in now. So I think while rates are super high, I would be trying to postpone things until things come down.
So is it fair to say that if you take a test like this, let's say you're going to go to a friend's house and it's positive, then don't go. You have COVID, stay home, assume that. If it's negative, you can't really assume a whole lot.
I think you can say, again, I think we have to stop thinking about these tests as tests of infectiousness and thinking about them as tests of quantity of virus. So if it's negative, it means at this moment in time, assuming I did everything well, I collected it properly, I did it properly, I don't have a lot of virus. I may actually have virus in another part of my respiratory tract, or I may have virus that's what we call below the limit of detection. So I don't have enough to register as positive with the test. And so right now, yeah, I mean, the CDC hasn't updated their antigen guidance since I think September 9th of 2021. The recommendation has been, obviously, if you're symptomatic and it's positive, right, you've got COVID. If you're asymptomatic and going to go to a party or to mix with others and it's positive, yes, assume it's positive, but you should still seek confirmatory testing if you can, but assume you're positive. If I were asymptomatic and got a positive test, I would still be trying to get a PCR just to confirm, but there's so much of it right now, you know, I mean.
And that's the other question I was going to ask you about PCR versus the antigen testing. Let's say you get the antigen testing and it's positive, but you feel perfectly fine. Should you get a confirmatory PCR test?
I would I mean, I'll give you an example. Like, you know, my husband, he's a healthcare worker. He had a false positive test with one of the rapid tests. So I think again, what I wouldn't want people to do is say, oh, it's probably a false positive, I feel fine. I hear that over and over again. I've even experienced it with my own family members, like even when they're sick, oh, I'm sure I'm not that infectious, I don't feel that sick. And you know, this virus, you can be pre-symptomatic, you can be fully asymptomatic and be shedding boatloads of virus. So just because you feel fine, if you have a positive test, you've done that test, assume you have it and get confirmatory testing if you can.
So overall, in the grand scheme of things, when would you go for an antigen test? When would you go for a PCR test?
So right now, we are facing an unprecedented amount of infections, the likes of which none of us, right, you as a physician, me as a clinical microbiologist, have ever seen this scale of an infection in the community, even at the worst of flu, right? You never see this many cases of flu in the ER, right? Not like this. And so right now, we have exceeded the capacity that we have for PCR. So if I were to get sick now, knock on all the woods, I don't, but if I were, I have a couple of rapid tests stashed in my medicine closet, in my medicine press, and I'm going to bust them out and I'm going to do that because I'm symptomatic and I'm positive. There's no reason for you to go get a PCR right now if you're symptomatic and you're positive. The calculus. Just assume right now. But I think that the issue for the public to understand is as the pandemic, as the waves come and they go, that was a different story a couple of months ago, right? You were vaccinated, you were fully vaccinated, you're symptomatic and you're positive. Well, I should get confirmatory testing. That's different now while we're in this surge. When things come back down, you know, down to low prevalence rates, it may be worth confirming then. But at this very moment in time, whenever you publish this, if you're positive and you're symptomatic by antigen, you have COVID. Assume you have COVID, done.
Now, the big question I've been getting from a lot of people is because of the information that Omicron, the variant, tends to be more in the respiratory tract in the throat than it does in the nose. And so the big question is, should people be swabbing their throat versus should they still swab their nose? FDA has come out saying, no, do it with the nose because that's the way the tests were made. What do you think?
Okay, so I think, yeah, there was this really nice preprint that was released, I think. I have no concept of time now. I think it was last week. It could have been like 2 weeks ago. I don't know. And so, yeah, what they found was very high concentration of the variant in the saliva, at higher concentrations that preceded the concentrations in the nose, and that people were getting falsely negative antigen tests in this study. One of the things that I think is really important to remind folks of, I mean, you held up one example of the antigen test that you have in your home. There are many different approved assays, and they all are actually slightly different. They target different parts of the nucleic capsid. They have different, you know, chemistry within the test. And so, although it looks to be, at least from that preprint and one other one from my South Africa that I saw, that it may be in the saliva or the throat earlier, We have to be really careful when we start using tests in ways that we haven't proven that are okay. And the reason I say that is, like, I don't know if you remember, there was like a bunch of teenagers that like tricked the antigen test into being positive by putting like Coca-Cola or something on it so they could get out of going to school.
Water. Right.
Yeah. So anytime we use a test in a non-validated way, sure, it's going to be right some of the time, but how much of the time is it going to be wrong? How much of the time is it going to give us a falsely positive result? How much of the time is it going to give us a falsely negative result? And that's where we have to think about sampling too, right? How good the quality of the specimen is. So until the companies have had a chance to make sure that for their device that there's nothing problematic with throat swabs, that is, if you do that, you're kind of taking it into your own hands, and you have to be aware that we don't know how reliable that result is one way or the other.
Now, what about the other theory that people are doing? You know, the other thought people have, and the way they're doing it is, and I believe this is the way they do it in the UK, is they swab the throat, then they swab the nose, then they do the test.
Yeah, so a combined, and it's interesting you bring that up because, you know, if you remember back to the beginning of the pandemic and everyone was getting the nasopharyngeal swab, the really uncomfortable one, like my brain is being massaged kind of situation. One of the things that we know is that at least for PCR, when we combine in a healthcare setting, you know, when we combine a throat plus an anterior nares, a nasal and a throat, that actually that it has a sensitivity that's pretty close to nasopharyngeal, but that's for PCR. And when we do PCR, that includes a step of extraction where you're basically removing the nucleic acid from all the other stuff in the sample and you're cleaning it up. That doesn't happen as much in an antigen test. So I think it's the same principle. It might be okay, but until we study it, we don't really know how often when it's positive, is it really positive? And how often when it's negative, is it not falsely negative because of something else in the sample?
And plus, I know from my own ER experience being a doctor, is getting that throat sample is not as easy as people think it is. Most people end up swabbing the back of their mouth, the back of their tongue, not their throat. And the throat seems to be the operative area that we need to really focus on. But again, most people aren't doing it correctly, or probably aren't doing it correctly.
I'm not going to lie. I'm a little nervous about people injuring themselves in their bathrooms, you know, in the absence of like being observed or having clear instruction. I think maybe it'll turn out that it's fine, but certainly if people are doing this, they should understand that it's not validated. We don't know how accurate it is. And if you're basing it on that, then, you know, you should probably try to get confirmed.
It's not the way the test was made to be done. It's not the way it was designed. So
we need studies to make sure it's working appropriately. Yeah.
Science.
Final couple of questions. The last one's going to be kind of, take home message for people that can leave them hopefully feeling good, seeing the light at the end of the tunnel type of thing. But before that, the big question I have for you is, when do we stop testing? At what point do we say, okay, we don't need to necessarily worry about testing so much?
You mean generally? Like
throughout the pandemic, or do we just continue testing forever?
John, this is a really great question. And as somebody has to deal with getting the supplies for testing and making sure that we have everything we need in the hospital, like for doing the testing, it's something I think about a lot. I think this is difficult at this very moment in time. Like if you look, some of the reference labs, they're not taking asymptomatic testing unless you've been exposed, because we've just overwhelmed the capacity of the system. I think testing has become, at least in the hospital, I don't see us not testing admitted patients or basically people being admitted to the hospital until, we seem to have quite a bit of distance between us and Omicron. I'm not sure when we're going to stop testing. Everyone keeps talking about this future state of endemicity. Well, I don't know when that's happening. I don't have my crystal ball. So I don't see us stopping testing as a society for quite some time. But I do think what we have to reckon with, particularly in times of crisis, which is now, like, let's just be clear, we clinical labs are in a state of crisis, the same way our patient-facing clinical colleagues are in crisis. We're in the crisis, you just don't see us because we're down in the lab. But we are going to have a reckoning if things don't resolve shortly about who can get tested and whether it's appropriate to test, because we are maxing out the system.
That makes sense. And so it might be the point it gets targeted testing, like you mentioned. If you're coming to the hospital, you're symptomatic, we want to test you, but otherwise, let's hold off for a little. Kind of the beginning of the pandemic where we talked about masks, let's say them for the healthcare workers, and then we eventually learned we all needed to use them, and might get back to that stage. But what would your parting words be for people as far as, giving them that little bit of hope about the pandemic, about testing, about anything going on right now?
I would say it's easy right now to feel a little hopeless. Certainly in the clinical lab, it's not the best time. But the thing that gives me hope is we know that we have vaccines that protect us from the really bad outcomes. We know that we have better quality masks that are more readily available than they ever were at the beginning. And we know that maybe we don't have enough, but we also know that we have rapid tests. And so I honestly think throughout this pandemic, one strategy versus the other seems to be constantly pitted like, no, it's this, no, it's vaccines, no, it's tests, no, it's all the things. And so the more we can get to all the things, vaccination, testing, better masks, that gives me hope that we can, by putting everything together, kitchen sink, throw all the things at it, that we have much more ability than we had in the past with respect to those things. And I'm hopeful that together, layering everything will pan out.
Yeah, you said it perfectly, because I always talk about all the tools in our tool bag. Not one of them is going to end the pandemic. Not one of them is going to keep you healthy. You need them all. And that's vaccinations, testing, masking, everything going on. So Susan Butler-Wu, again, thank you very much. This has been fantastic. Appreciate the time and appreciate the information about testing. This has been great. And I hope you have a wonderful rest of your week.
Thank you. You too. Lovely speaking with you. Thank you.